Hi there, my name is Katie Saints. I'm from Bucks Valley Autism, and this video is about puberty and autism. So, puberty is a pretty tough topic for all kids, and I think it's especially important for us to talk about it with our kiddos who have an autism diagnosis. This can be a really confusing time in a child's life. And so, if we can be the ones to prepare them for that and educate them on what that process is like, it's going to go so much smoother for them. So, this is really important that we be a part of this process. Kids are going to talk about it at school. As much as we want to protect our children from these kind of subjects, it's impossible to completely avoid it altogether because their peers at school are going to be talking about it and bringing it up at some point. And if their first exposure to this information is from their peers, they could get bad information, they could get confused, they could get scared or anxious about things. They might even make poor choices because they have bad information. So that's why I feel that it's so important that we be the ones as parents or therapists to cover these topics with our kiddos to make sure they're prepared and equipped. They know what to do and how to handle the different situations that they'll be in. This can be an uncomfortable conversation for a lot of people, and that's okay. It's okay if it makes you uncomfortable. It's okay if it makes your kids uncomfortable. It's more important to have these uncomfortable conversations than it is to avoid them and then potentially the harm that could come from our kiddos not being prepared for what's to come. So, to start with, I have a list basically of all the different things that I think are really important to cover, and what kind of stuff you should talk about with your kids. Now, depending on your child's functioning level, you're going to cover it in different ways. Some kids you can have in-depth, really lengthy conversations with. Other kids going to be more basic. You're going to be giving them more straightforward information, or you might just be practicing different hygiene things. And so it'll look different based on each kid. And if you want advice specifically on how to talk with your kiddos about these subjects, reach out to your therapist or to me, and we can walk you through that, or we can walk your kiddos through that if you prefer that we be the ones to cover it. So, one thing to start with is just the basic information on what kiddos can expect when they go through puberty. It typically starts between ages 9 and 11, and it can really vary. Some kids are going to start early, some kids start late. And so I really recommend starting these conversations when kids are 7. Some of the body and boundary conversations I would actually start way sooner, but I'll get more into that later. But again, we want to beat our kids' peers to this subject, and we want to beat puberty to the subject as well, meaning it's important you talk about it before the kids have already gone through it, because a lot of kids experience new things, like they're growing hair in places they didn't have before, or they're starting to smell, or there's those different bodily changes, and that can be confusing for them or embarrassing. So if we can prepare them for it, it's really going to help. Also, starting at a really young age, it's so important to talk about body and body image, especially for girls. As young as 4, girls are aware of their bodies and aware that they're supposed to, according to society, look a certain way. And you hear little girls talking about, I'm fat, or I need makeup, and that really stinks that that's where our society's at right now, and that so many people struggle with body image issues. It's not just girls, guys can struggle with it too. So, what I really recommend starting at a young age is talking about what your body can do instead of what it looks like. So, focusing on how cool it is that your body is healthy enough to explore and to maybe lift heavy things, or how cool it is that you're really funny. It doesn't have to just be focused on the physical things that your body can do. Maybe you're really clever. Um, maybe you know a ton about a certain topic. And so just really emphasizing that those are the kinds of things that matter, not if you have six-pack abs or if your body looks the way you want it to, because we all have flaws. And so it's just really, really important that we work on helping our kiddos have a healthy body image, because, like I said, in our society, that can be really hard. So, the other thing I want to talk about in regards to body image is just the whole middle school acne thing. That can be so embarrassing to kids, and they can feel like they look so hideous. And, sometimes middle schoolers are really mean to each other, so they might get picked on. So education on two sides of that is helpful. One, teaching kiddos how to take care of themselves and be clean. The importance of washing their face twice a day, and if they work out and get sweaty, washing their face right after before the sweat dries can help prevent acne and things like that. But also, just that it's normal and that it's okay. Everybody gets acne. Some people get more, some people get less. Um, but that's okay. Again, focusing on there's more to you than how you look. And you can contribute socially regardless of if you have a bunch of zits and all of that kind of stuff. So just helping kids have that self-confidence. Um, the ages around puberty are typically really insecure years. And so the more we can be doing to build kids up and to help them value themselves and see their worth beyond their looks is so important. So the next thing that I'd like to cover is, who does your body belong to? And so this is a concept that is really important for our kiddos to understand, is that their body is their own and they have the right to say no. And so, a lot of times people with autism can be confused about boundaries and personal space and things like that. A lot of therapy sessions include practice and education around boundaries. And so it's super important that we teach our kiddos that they can say no and that their body is not free for anyone to touch. And so we can start teaching that at home by respecting their boundaries. If they don't want to be touched, we shouldn't touch them. If you want to hug your kid and they're not in the mood for a hug, respect that. If grandma comes over and she wants a hug and your kid says no, don't force him. And sometimes that can be hard because you really don't want to hurt your family's feelings by your kid rejecting a hug. But at the same time, if we allow our children to say no to family members over physical touch, that's going to help them say no to potential predators when they're older, or when they're in the community and you're not there. That's going to help them have the skills to protect themselves. So educate your family too that this is something you're encouraging your kids to do so that they don't take it personal, and hopefully they can help be supportive as well. Additionally, our kiddos are really at risk. Kids with autism are at risk for both sides to be victims, but also to cross other people's boundaries. And this isn't usually from a bad place. It's usually from a place of innocence, that they truly didn't understand that what they were doing is wrong, or that it was creepy or inappropriate. A lot of times it's so innocent, they just didn't know. And so that's why it's so important for us to talk about boundaries and talk about respecting other people's boundaries. And so this conversation can start so young, like 3 years old, maybe even younger, talking about good touch, bad touch, things like that. Um, Going over with your kids who can touch your body and where. So, talking about the doctor can check all of your body parts, and that's okay. Usually, mom or dad is there too, so you know it's a safe place, and the doctor's doing it to help you be healthy. But if you're at home or at somebody's house and somebody wants to play doctor and pretend to be doctor and touch you in places like that, that's not okay. And so having those blunt conversations of scenarios to come that could come up and how you would want your child to respond to that is really good. The more examples you can give, the more likely they are to be able to handle a situation that's thrown at them, and hopefully respond in a way that will protect them and will protect the other kids. So, another activity that's really good to go through with your kids is talking about what zones of the body are okay to touch on other people and what zones aren't. So, for example, you can shake most people's hands or touch somebody's shoulder, but you probably shouldn't touch anyone's stomach. You shouldn't touch anyone's private parts. So, even making sure your child understands what private parts are, where they are, and when they can be touched, when they can't be touched, who you can touch. Your child shouldn't have a reason to touch somebody else's private parts, and so educating them on that will help them make safer choices. And so, um, also educating them on if they have pain or discomfort or something going on with their private parts, who they can talk to about that and who can help them with that, and who really shouldn't help them or even know about it. Um, so just talking through that with your kiddos is really helpful and can prevent a lot of harm. The next thing um, on this subject I'd like to talk about is nudity in families. Because boundaries can be especially confusing for people diagnosed with autism, I really recommend that once your child starts getting close to puberty, that you be so careful about making sure your child shuts the bathroom door, or not showering in front of other people and things like that. If your child is still gaining independence in some of those skills where they need help, that's okay. And you can continue working on that independence, but give them as much privacy as possible to help show them um, those boundaries, and to help them get really used to, like, hey, I'm changing, I need to do this in privacy, not in front of my mom. I think for parents sometimes it's hard because we truly don't care. Like, we raised the kids, we've seen them naked, we've changed their diapers, so we think nothing of it. But really, if we set those boundaries with them, it helps them learn how to set boundaries for themselves, and it's going to protect them later on when they need to set their own boundaries. So, next, go over basic anatomy and how to be clean about it. So, especially for girls, once they go through puberty, hygiene is so important, and them handling their menstruation in a clean way is really important, and it's going to prevent embarrassing situations for them. We don't want them um, ruining their clothes or being in public and having things show that can be humiliating for a kid. And so we really want to help them prevent that. You can also really get sick and things like that if you're not changing things enough, or if they're trying to put tampons in and they're not doing it correctly, it could cause pain. And so it's really important that we educate our kiddos on how to handle those kinds of things, um, and how to be clean and safe about all of that. For guys and wet dreams and things like that, you're gonna need to have that conversation and about cleaning that up, and making sure if it's on your clothes that you put your clothes in the wash, and just that whole process to prevent them from having embarrassing situations. um, some of our kiddos have had things like that on their clothes, and they didn't realize that that was a gross thing, and so then they were bullied because of it. So we just really want to help our kiddos prevent themselves from being in those uncomfortable situations, or situations where they would be bullied or made fun of. The more we can proactively have those conversations with our kiddos, hopefully the more we'll prevent. So the next thing along those lines are about clothing. As you mature and go through puberty, your clothes kind of change, especially for girls, but guys too. So one thing to think about, a lot of our kiddos have sensory issues. Wearing bras can be a whole new sensory experience, and some of our kiddos really resist that, and that's really hard for them. So it's really great if you can kind of help your child prepare for that by getting different bras that are maybe more tank top like, and kind of building up to it. So if you expect your child to have sensory issues, there's ways to kind of build up to it so that they're less resistant to it, and that way they're appropriately covered. Especially if your child is going to participate in sports and things like that, they're going to need more supportive clothing as they mature, and so it's really good to help your child get comfortable with that kind of stuff and be okay with that kind of stuff. Quite a few of our kiddos have really resisted that transition. So talking about it in advance, getting clothing that's less restrictive and adversive, to help prepare for that. Sports bras, things like that, can be more comfortable than wired bras, and so just kind of strategically picking what you think would be easiest on your daughter could help make that process a little easier. So I want to talk a little bit more about good touch and bad touch, and showing affection, and playing when playing sometimes goes too far. So it's really, really important that you have conversations about good touch and bad touch, and you give scenarios on how to handle touching situations, and actual examples of what's okay and what's not okay. 95% of sexual abuse happens from family members, actually, and so it's really important that our kiddos know the difference between good touch and bad touch, even from people they trust. So identifying at what age you want to start setting more boundaries as far as physical touch goes. So for example, when a kid is 4, if they sit in your lap, no problem. That's really age appropriate, and that's okay. But if your kid is getting to be in the teenage years, that starts to be a little less appropriate, and that can cause some boundary confusion issues. And so kissing on the lips, for example, a lot of families do that, and that's perfectly okay. But sometimes that might be a good thing to limit as your child gets older, if your child struggles with boundary issues, and if it's confusing for your child on who's okay to touch and who's not. You might want to have more boundaries in that sort of area. There is a program that we use with with a lot of our kiddos called Circle of Friends. And so it goes through the different types of friendships and relationships. So you have family, you have close friends, you have acquaintances, you have strangers, you have coworkers, you have classmates, all of those different people. And so breaking down for your kiddo who you can touch, how you can touch them based on what category is really helpful. And going over those scenarios and practicing will really help your child have a better understanding of what's okay and what's not. Again, we want to protect our kids from being victims or accidentally hurting somebody else. And so sometimes that requires us to have extra boundaries and extra conversations to help teach those concepts. So the next thing I want to talk about is unsafe people. Along the lines of good touch and bad touch, it's really important that our kids learn how to identify who unsafe people are, because sometimes that can be really confusing. People can be good at seeming really nice and charming, um, and kind of manipulating you um, in order to get you to do something. Or quite a few of my teenage clients have shared how people have guilt tripped them, like, hey, I'm really depressed, send me a picture of your chest and that would make me feel better, and if you don't, you're just a prude, or you're really a rude person, everybody does it so you should too. So those kind of conversations are happening with teens a lot, unfortunately. And so it's really important that we educate our kids on that and how to handle that, how to prevent that, how to say no. Having those conversations and even role playing with our kiddos, having them say no will help them if a situation like that really does occur. So, also talking about if it's somebody who says, keep this a secret, don't tell anyone, making sure our kiddos know that they should never keep it a secret if somebody touches them inappropriately or makes them feel uncomfortable or unsafe. So, making sure they know that no matter what, if somebody threatens them, if someone says, you know, you're going to get in trouble or I'm going to get in trouble, so don't tell anyone, making sure they understand that they should tell. Absolutely, they should tell, no matter what that person said. And so if we don't have those kind of conversations with our kiddos, that kind of manipulation can be really powerful. So it's really important they know that they should never keep those secrets. So that's also when it's really good to have the conversation about good secrets and bad secrets. So, kind of teaching like, hey, if I bought you a birthday present and I kept that a secret until your birthday, that's a good secret. If I'm having a surprise birthday party for you and I didn't tell you about it, that's a good secret. But if somebody touched your private parts and you didn't tell me because you were afraid or whatever, that's a bad secret. That's something you should tell. If somebody got hurt, um, that's a bad secret. That's something you should tell. So just helping kids understand the difference between good secrets and bad secrets. That can be especially confusing for a lot of our kids with autism because they often have really literal minds, and so things tend to be black and white. Either you keep secrets or you don't. And so having conversations about that can be really helpful. So around the age of puberty is also where you start to talk about where babies come from. Around this age, a lot of kids start asking more and more questions. And so typically, I give more of a textbook answer regarding sperm and eggs and ovulation. A lot of our kiddos tend to respond pretty well to an academic type answer in this regard. And this is also really helpful in just educating them on anatomy and body parts, and it bridges really easily into hygiene conversations and things like that too. So depending on where your child's at developmentally, this can be also a good conversation about sexual boundaries and things like that. Kids are having sex as young as 12, sometimes younger. So that's a conversation that needs to be had earlier than most people, I think, realize. So, so having those kind of conversations around this age is really good. Another thing that can be helpful to talk about is actually slang words for body parts. And the reason this can be valuable to talk about is to protect your kids. So if other kids at school are talking about body parts in slang and your child doesn't know what they're talking about, this can put your kid in a situation where they maybe don't know that somebody is making fun of them or talking sexually with them. And so talking to your kids about different slang and how you feel about that slang, if it's okay to use, if it's not okay to use, and all that kind of stuff, educating your child on those things are going to help protect them and help them to have more appropriate behavior. Another thing to talk about is how friendships can change as you go through puberty and get older. You're going to have more boundaries with friendships as you get older. And so you maybe would have a sleepover in the same room, in the same bed when you were younger. But then as you get older, you maybe would do that less. Or guy-girl friendships sometimes will change. Just talking about how that happens and that's normal, talking about what kind of boundaries you feel like your child should have around members of the opposite sex or same sex. Just all of those different rules and expectations are really good to go over and talk about. Another thing that's super important is internet safety. More and more games have that social component, and in some ways that's great. It's social skills practice for our kiddos in a way that they maybe are a little more comfortable with because it's online and not face-to-face. But the problem with that is people can fake things pretty good online. We've all heard the horror stories of people tricking kids into thinking they were something they were not. And so we just want to be really, really good about educating our kids on internet safety and meeting people online, making friends online, just all that kind of stuff. The risk really goes up once you hit that puberty age as far as the inappropriate conversations that start to happen and all of that kind of stuff. So it's so important that we feel confident in our kids' ability to make themselves safe. Along those lines, as kids start to get on Facebook and the different social media avenues, educating them on appropriate pictures and helping them to understand that nothing is private, even if they think it's private. So say, for example, they are on Snapchat and they're sending pictures to someone on Snapchat, assuming that those pictures disappear and will never be seen again. There's no guarantee of that. They could just take another device and take a picture of, their phone or whatever, of whatever message you sent. So just getting kids to understand that nothing is private and that they need to be so careful about what they send and that they really should have appropriate pictures, and just helping them understand the impact of posting pictures that are not appropriate and all of that kind of stuff. Our kids need to be protected, and the biggest way we can protect them is through education, through having these conversations. It can be awkward, it can be uncomfortable, but it's so important. This is how we protect our kids, this is how we equip our kids, and this is how we can then feel comfortable and confident that they're going to be able to be safe in the situations that they are thrown into. So, puberty is a tough age. Also, just from a parent perspective, expect that your child is going to make a lot of changes. Sometimes it's for the better, sometimes it's for the worse. Usually the changes are temporary. A lot of times before a kid starts puberty, they go through a bit of an emotional storm. Hormones are raging, so their behavior might look really different. So helping your child work on regulation skills and kids are really at risk for anxiety and depression during the puberty years. So just making sure that your kid is working through that and that they have someone that they can talk to and that you're being proactive about their mental health during this time is really good. But also your own mental health. It can be hard as a parent to have kids at this age. So just making sure that you're taking care of yourself and doing self-care for yourself as well so that you can be the best parent to them. So, all right, I hope you found this chat helpful on puberty. And again, please feel free to contact me with any questions.